Hello everyone and welcome to my anatomy class. Once again, it's a pleasure to have you with me, and today we are going to discuss the seventh cervical vertebra, which is another atypical cervical vertebra. And you will recall that the third, fourth, fifth and sixth cervical vertebrae were the typical cervical vertebrae. The seventh is an atypical one, and with the discussion of the seventh cervical vertebra we will conclude this series on the cervical vertebrae. Let us take a look at the seventh cervical vertebra and another typical cervical vertebra for comparison. Now here they are. Here you have a seventh cervical vertebra and here you have a typical cervical vertebra. You can make out the difference. The seventh cervical vertebra is easily identifiable in the exam and in your collection as well, and let's see what's so different about it. See, the body of the seventh cervical vertebra is gradually trying to adapt itself to the thoracic structure. That means the anteroposterior diameter is still smaller than the transverse, but it is getting larger as compared to the other cervical vertebrae. On the transverse process, the anterior tubercle is blunted. It is almost invisible, and this corner, this little bit of the anterior root, this is what remains of the costal element. The remainder of the posterior root and this posterior tubercle over here, they are part of the transverse element. And the other thing that strikes you is this very prominent and enlarged spine. So this spine is easily felt at the nape of the neck, and that is why the seventh cervical vertebra is also called the vertebra prominens. Now regarding all the other structures, they are the same as in the other cervical vertebra. You have the body, you have the pedicles, you have the superior vertebral notch, you have the inferior vertebral notch, and you have the superior pair of articular facets, the inferior pair of articular facets, and these the two facets together are on the articular process. Then you have the lamina, one on this side, one on this side. The lamina are broad flattened plates of bone. The two laminae unite to form the spine, very prominent elongated spine, which is again like the cervical vertebra, almost horizontal. Now this is all that you need to know about the extra parts of the extra special features of the seventh cervical vertebra. What is new beyond all this is just some of the attachments of the seventh cervical vertebra. Let's look at that on the board. See, here on the seventh cervical vertebra you can see this is the body, these are the pedicles, the pair of superior articular facets, the pair of inferior articular facets, and this here is the lower part of the body, and the laminae and the prominent spine. And you can make out that these are the foramen transverse area in the transverse process. What is different immediately is that this anterior tubercle is rather blunt over here, and the rest of the posterior tubercle takes up the major part of the transverse process, and this somewhat broad intertubercular lamella over here. And you can see the attachment of this muscle, scalenus minimus, and a fascia which is called Simpson's fascia. Now this scalenus minimus is part of the scalene group of muscles. You know that you have the scalenus anterior, scalenus medius and scalenus posterior, and this scalenus minimus is a very small muscle, and this fascia that you have here, this Simpson's fascia, is also known as the suprapleural membrane. It extends from the transverse process of the seventh cervical vertebra to the inner margin of the first rib. Look at this picture. This is the transverse process of the seventh cervical vertebra. This is the transverse process of the first thoracic vertebra, and from the tip of the transverse process of the seventh cervical vertebra, here is your Simpson's fascia or suprapleural membrane, and this is the outline of the first rib. What you can make out is that this is the apex, the apical pleura, the apex of the pleural sac, and underneath you have the apex of the lung. So it follows that the apical part of the lung and the pleura are not totally contained within the thoracic cavity, but they are peeping out at the root of the neck, and they are rather exposed. And this suprapleural membrane, which extends from the transverse process of the seventh cervical vertebra to the inner margin of the first rib, gives some amount of protection to the exposed apical pleura and the apex of the lung. And these red streaks that I have drawn here, these represent the few muscle fibers that are incorporated into the Simpson's fossa and which serve to remind us that this is the scalenus minimus muscle. So this scalenus minimus consists of a variable amount of muscle fibers extending from the transverse process and going up to the inner margin of the first rib along with Simpson's fossa. Another important point is that in the foramen transversarium you cannot find the vertebral artery, but you can find the veins. So that means the vertebral artery has not passed through the foramen transversarium of the 7th cervical vertebra. Rather, the vertebral artery will rise up and pass through the foramen transversarium of the 6th cervical vertebra, and then it will go up through the foramina transversaria of the other cervical vertebra right up to the atlas. Rarely it may also happen that the vertebral artery may not even pass through the foramen transversarium of the 6th cervical vertebra. It may pass through the foramen transversarium of the 5th cervical vertebra. And again on the bodies you can make out these transverse lips. These lips which are going to form the uncovertebral joints with the lower border of the body of the 6th cervical vertebra. And over the intertubercular lamella you can see the emergence of the 7th cervical spinal nerve, the ventral root, the ventral ramus and the dorsal ramus. You can see the ventral ramus and dorsal ramus of the 7th cervical vertebra over 7th cervical spinal nerve over here, and below you can see the emerging 8th cervical spinal nerve. So in the cervical vertebra, as you know, the number of the spinal nerve corresponding to the number of the vertebra passes above the vertebra, and the subsequent nerve passes below the vertebra. So if this is the 7th cervical vertebra, the 7th cervical spinal nerve will pass between C7, the 7th vertebra and the 6th, and 8th cervical spinal nerve will naturally pass between the 7th cervical vertebra and the 1st thoracic vertebra. So because there are 8 cervical spinal nerves and there are only 7 cervical vertebrae, so it follows that below the 7th cervical vertebra, from the thoracic vertebra onwards, the number of the spinal nerve that corresponds to the vertebra will pass below that vertebra. So the 1st thoracic spinal nerve will pass below the 1st thoracic vertebra, 2nd thoracic spinal nerve will pass below the 2nd thoracic vertebra, and so on and so forth. And again the remaining parts, the superior articular processes, the superior articular facets forming the zygapophyseal joints with the 6th cervical vertebra, synovial plane joints with the margins giving attachment to the fibrous capsule. And again to this transverse process you have the attachment of the first levator costae, the elevator of the ribs. This is attached again to the first rib, and again you come down to this robust spine, this rather robust spine, and to this robust spine which actually give rise to the name vertebra prominens, you can see the attachment of this ligamentum nuchae. So from above, from the external occipital protuberance, that is from the occipital bone downwards, you have the ligamentum nuchae to the tip of the spine, but below, from the 7th cervical vertebra going below, the ligamentum nuchae will be continued as the supraspinous ligament. So ligamentum nuchae is continuous with the supraspinous ligament. Between the spines you have the interspinous ligament. Between the transverse processes you have a very flimsy intertransverse ligament. And to the spine, to the robust spine of the axis, you have a number of muscles. From outside inwards you have trapezius, you have spinalis capitis, you have semispinalis thoracis over here, you have the multifidus over here, and you have the interspinalis here. Now as I have said that you need not memorize all these muscles for the exam. If you have a very aggressive examiner, a very intense examiner, he might ask you the names of 1 or 2 of the muscles attached to the vertebra. If you can recollect 1 or 2 names, it's well and good, but if you can't, it's not such a big deal. So it is not essential that you memorize the names of all of these muscles, these small muscles attached to the vertebra. Now we have drawn the 6th cervical vertebra. Although traditionally we don't consider the 6th cervical vertebra to be atypical, however there is one feature which is slightly different. Now we do have a specimen of the 6th cervical vertebra. You see, this is the 6th cervical vertebra, this one, and this is a typical vertebra. Now the difference is that in the 6th cervical vertebra, this anterior tubercle is very prominent. You see over here in the typical cervical vertebra, this anterior tubercle is not so prominent. Now in the 6th cervical vertebra this is prominent, and this is called the carotid tubercle. So here you have the carotid tubercle prominent, and there is a prominent groove between the body and the anterior tubercle and the anterior root. So what you can, the importance of this is that in order to temporarily stop bleeding, the common carotid artery can be compressed over the carotid tubercle and in the groove between the carotid tubercle and the body of the vertebra. So this is called the carotid tubercle. It is much more prominent. It is much more prominent than the posterior tubercle, whereas in the bodies of all the other typical cervical vertebrae, the anterior tubercle is not so prominent. On the 7 it's hardly visible at all, but here also it is not so prominent. That is why, for the sake of completion, we have drawn the 6th cervical vertebra over here, and we have drawn the prominent carotid tubercle and a picture of the carotid artery at this point. And let us go on to the ossification of the 7th cervical vertebra. As usual, we have drawn in green the primary centers, in blue the secondary centers, and a special secondary center in this orange color. Now the primary centers, you can see there are 3. One primary center for the body appearing at the 12th week of intrauterine life, and 2 primary centers at the roots of the transverse processes appearing at about the 10th week of intrauterine life. Secondary centers, they all appear at puberty. So you have 2 secondary centers for the tips of the transverse process, 2 secondary centers for the upper slice of the body, lower slice of the body, and 1 secondary center for the spine over here. So the body of a vertebra behaves like a long bone in that it does have a primary center of ossification which functions as the diaphysis, and you have 2 secondary centers of ossification appearing at about around about puberty. So these 2 function as the epiphysis. So as a whole, the body of a vertebra does appear to be like similar to that of a long bone. Now, so you have 1 additional center of ossification over here. See, this red one is here. It appears at the 6th month, and this section of the anterior root, it is the costal element. This is special. It fuses with the rest of the bone at around 5 years. So this special center of ossification for the costal element appears at 6 months, fuses at 5 years, and the center for the body as a whole fuses with the vertebral arch at the 3rd year, and the 2 halves of the vertebral arches, they come here and fuse at about the 1st year. Now these special centers of ossification, these 2 which are forming the costal elements, sometimes they might develop a little more. They might elongate to form an incomplete or complete cervical rib. Cervical ribs, as you know, may be bony when they have a prominent existence. It may be cartilaginous or even occasionally fibrous, but they arise from this center, this additional center that you have for the costal element. So now more or less we have completed the cervical vertebra, the atypical as well as the atypical. For the exam, you must remember that these ligaments you must be able to mention. The anterior longitudinal ligament to the body, posterior longitudinal ligament to the body, ligamentum flavum to the lamina, ligamentum nuchae to the spine, interspinous ligament again to the spine, and intertransverse ligament between the transverse processes. Apart from these, you have a special set of ligaments for the atlas and axis, and beyond the 7th cervical vertebra, the ligamentum nuchae will be continuous as the supraspinous ligament. Now, because we are going to go away from the cervical vertebra, I will show you for the last time a little bit of a summary of the cervical vertebrae. So here I have a summary of the cervical vertebrae. You can see these, and in this summary you can make out that the cervical vertebra, the typical cervical vertebra, it consists of the following parts: a body, a vertebral arch, pedicles, articular processes, transverse processes, laminae, and spine. And you can make out that in the body you have 6 surfaces. You have upper surface, lower surface, anterior surface, posterior surface, right surface, left surface, and these surfaces have different features. The upper and lower surfaces, they articulate with the bodies of the vertebrae above and below. The right and left sides, they give rise to the pedicles. The anterior and posterior surface give attachment to the anterior and posterior longitudinal ligaments, and you can see that the body has got 3 lips. It has got 2 lips on each side like ears, and they are forming the ancovertebral joints. They are also small synovial joints, mini synovial joints, and the anterior border or anterior surface of the vertebra has got a ventral lip below, which covers the intervertebral disc from the front view. And the bodies of the and you can see that the body of the vertebra, and it forms 4 joints, that is the joint above and below with the intervention of the intervertebral disc, the secondary cartilaginous joint, and the 2 ancovertebral synovial joints on the sides, total of 4 joints. And we have already mentioned that the body of a vertebra behaves like a long bone, so that part you have to keep in mind, that it has a diaphysis, it has 2 marginal small slice epiphyses, and there are 2 ligaments, anterior and posterior longitudinal ligaments, attached to the body of the vertebra. Now the vertebral arch and the body of the vertebra enclose the vertebral canal. In the vertebral canal you have the spinal cord with its meninges and epidural plexus of veins and some amount of loose areolar tissue. The pedicles form the superior and inferior vertebral notches, and the pedicles arise from the body, and over the pedicles you have the passage of the spinal nerves. Now these superior and inferior vertebral notches, when the vertebrae articulate with each other by their facet joints, these form the intervertebral foramina for the exit of the spinal nerves. And if you consider one intervertebral foramen, in front you have an intervertebral disc and adjacent sides of 2 contiguous vertebra, and posteriorly you have the facet joints, that is the zygapophyseal synovial joints, and above and below you have the 2 pedicles. So it is this rounded opening through which the spinal nerves have to pass, which are subject to different types of pathology and narrowing. And then you have the articular processes. You have a superior pair and an inferior pair of articular processes, and these articular facets will form 4 joints. These are synovial plane joints. Transverse processes bear the foramina transversarium, through which pass the vertebral artery except the 7 cervical vertebra, the vertebral veins, and a sympathetic nerve net over the vertebral artery. And in the transverse processes you have the anterior roots and anterior and posterior roots and anterior and posterior tubercles, and the intertubercular lamella, previously called the costotransverse bar, over which pass the spinal nerves. Next you come to the lamina, which are flat plates of bone and which give attachment to the ligamentum flavum, forming a sort of a fibrous joint. And this on the spine you have the ligamentum nuchae and the interspinous ligament. So that concludes our study of the cervical vertebra. Now we will be moving on in our next class to the cranial bones. Thank you.